Pox virus. DNA viruses are pox virus, parvovirus, pepovirus. Pepo stands for papilloma, polyoma, vacuolating virus, virus, herpes virus, adenovirus. Okay. RNA viruses, paramyxovirus, orthomyxovirus, then enteroviruses, rhabdovirus, retrovirus, arbovirus. So these are all you should remember. Retrovirus is HIV. Here important is dengue, chikungunya. Rhabdo is rabies. Enterovirus is poliomyelitis. The paramyxo, orthomyxo, influenza and parainfluenza. Influenza, the pox totally eradicated from the globe by vaccination by Edward Jenner. Parvo gives rise to exanthemata, Papoa, papilloma polyating virus, virus, it causes hepatitis B. Herpes, herpes simplex 1 and 2, cytomegalovirus, Epstein-Barr virus. Epstein-Barr virus and VZ virus. VZ virus gives rise to chicken pox. VZ virus gives rise to chicken pox in childhood and herpes zoster in adulthood. Chicken pox gives rise to chicken pox in childhood and herpes in the adulthood. Chicken pox in childhood, herpes in the adulthood. Now, fungi are classified into yeast, yeast-like, dimorphic, and molds. Everybody, yeast-like, dimorphic, and mold. Example of yeast is example of yeast is Cryptococcus, neoformans. Cryptococcus neoformans. It is found in the pigeons species. It is found in the pigeon species. Man get infected with inhalation and it gives rise to meningitis, and infection of the lung. Like tuberculosis. And it is stained with negative staining by India ink or nigrosin. India ink or nigrosin. India ink or nigrosin. Okay. Yeast like is Candida albicans. It's normal commensal in the oral cavity, and it is budding and forms pseudohyphae. It gives rise to oral thrush and moliniasis in female. Oral thrush and moliniasis in the female. Dimorphic, you remember, with mnemonic HBC, histoplasma capsulatum, blastomycosis, bicosis, coccidioidomycosis, coccidioidomycosis, paracoccidioidomycosis. You remember few, okay? Paracoccidioidomycosis. And the example of mouths show hypha. Hypha or hyphae. Hypha is singular, hyphae is plural. They are rhizopus, mucar, rhizopus, mucar, penicillium, aspergillus, and dermatophytes. Dermatophytes. They infect hair, nail, they infect hair, nail, and skin. They infect hair, nail, and skin. There are three dermatophytes: epidermophyton, trichophyton, microsporum. Epidermophyton, epidermophyton, trichophyton, microsporum. Tri means it infects all three. Trichophyton infects all three: hair, nail, and skin. Epidermophyton will not infect hair. Remember it as Entamoeba histolytica, EH. And microsporum will not infect the nail. MN. N come after M. Nail. It will not infect the nail. So all fungi are grown in Sebrots dextrose agar. Sebrots SDA. It is selective to fungi because pH is 5.4, acidic pH. All culture media pH is 7.4, optimum pH. So in alkaline pH, cholera, alkaline peptone water, you must have heard. Vibrio cholera is grown in alkaline peptone water is used as a transport media. Alkaline peptone water is used as a transport media. So acidic media 5.4. So you add chloromazine, it becomes selective for dermatophytes. It becomes selective for dermatophytes. So adenovirus, there are adenoid glands. Everybody hold like this. Adenoid glands in the upper respiratory tract, and adenoviruses they infect the adenoid glands. That's why the name derived as adenovirus. Adenoviruses. Adenovirus. Okay, because they were first isolated from adenoids. Adenoviruses are a group of medium-sized, non-enveloped, double-stranded DNA virus have a common complement-fixing antigen. Adenovirus infects worldwide, commonly in children. Adenovirus confirms infection of the respiratory tract. It infects the respiratory tract, eyes, eyes, respiratory tract less of one, UTI, UTI, and intestine. So gastroenteritis, ophthalmitis, respiratory tract RTI, respiratory tract infection, RTI. Okay, so it looks like a satellite. Looks like a satellite. Adenovirus measures about 70 to 70 micron, capsid 250. This is called capsid. This is called capsid, and it has got 12 hexons, 240 capsomeres, pentons, 12 capsomeres, each penton based on anchored capsid. Family Adenoviridae, 2 genera. Mastoidenoviridae, Arenavirdae. In human, 50 serotypes. In isolated, divided into A to F based on the properties like hemoglobin, fiber length, DNA fragment analysis, and oncogenic protection. Causes infection of the respiratory tract, eye, bladder, and intestine. So it infects the lungs, eye, urinary tract, and intestine. More often, one type, same time cause disease. One type can produce different diseases. So respiratory infections 1, 2, 5, 6, sore throat 3, 4, 7, 4, 20, 21, acute respiratory in military recruits, distress 4, 7, 21, conjunctivitis 3, 7, keratoconjunctivitis 8, 9, 37, strain number, okay, diarrhea 40 and 41. Pharyngitis, tonsillitis, adenovirus are main cause of bacterial pharyngitis and tonsillitis. Pneumonia, acute respiratory disease, outbreak in military recruits, pharyngoconjunctivitis 3, 7, 14. Keratoconjunctivitis 8, 13, and 1937. Acute follicular conjunctivitis 3, 4, 11. Purulent conjunctivitis. Diarrhea 40 and 41. Hemorrhagic cystitis. Cystitis means infection of the bladder. Okay. The 11 and 21 generalized exanthema in children, mesenteric adenitis, and intercellular. Tissue culture, it should be grown and CPE, common complement fixing antigen subgrouping, hemoglobin on rat, monkey, rats or monkey kidney RBCs, typing by neutralization test. Serodiagnosis, rise in antibody titer, electron microscope, immunofluorescence by nasopharyngeal swab, PCR, polymerase chain reaction for viral DNA. Adenoviruses recruits, it occurs in military recruits, killed vaccines are used. Gene therapy, adenovirus has a spare capacity to carry DNA insert 14 Cbme potential vector for free gene therapy. Adenovirus has capacity to transform cell culture in induced tumors. Adenovirus associated virus, satellite virus, electron microscopy revealed small icosahedral virus particles dependent on helper viruses classified as dependent viruses under parvovirus. Viral gastroenteritis. Please remember, sometimes they'll ask you for questions, viruses that cause diarrhea in man. Viruses, first one is because wheel, it looks like a wheel. That's why it's called as rotavirus. Rotavirus. Then calcivirus. Rota, calcivirus, astrovirus, then adenovirus. So segmented double-stranded RNA, most common cause of severe diarrhea in children. Group B causes outbreak diarrhea in adult children. Calcivirus single strain causes outbreaks in vomiting, diarrhea. Sapovirus single strain causes sporadic, causes occasional outbreaks. Astrovirus outbreaks diarrhea. Adenovirus, just now you heard, seen the adenovirus 4041 causes diarrheal illness. Rotavirus. Rotavirus most common cause of diarrhea in children. Rotavirus 62 nanometer and icosahedral in shape. This is icosahedral, okay? Icosahedral in shape, triple layered wheel shaped, possess double strength RNA, 11 segment proteins, 6 structural proteins, non-structural proteins, and viral proteins. Rotaviruses are they look like a wheel and spoke, so it's called as rota. Rotavirus further classified into 7 group A to G. Most human causes diarrhea is A. They classify binary fission typing. Recent classification rotavirus by binary fission, genotyping VP4, members are expressed P1 and P2, serotyping method VP7, and serotypes number expressed G1, G2, etc. Binary system typing depends on 19G. Most common type is seen worldwide as GP1P in the bracket 8. Diversity among the rotavirus types is more commonly encountered in the areas of poor hygiene. Transmitted by fecal route, multiply in the enterocyte. The virulence factor is non-structural protein NSP4. Produces enterotoxin, induced secretion by altering epithelial cell function and permeability. Incubation period is 1 to 3 days. Abrupt onset, recovery usually occurs majority of few children and may suffer from severe loss of electrolytes and fluid leading to dehydration. Epidemiology. Single most important cause of gastroenteritis. 3 to 5 billion diarrheal cases occurs in children. Rotavirus in developing countries occurs in younger age, less seasonal, more frequently caused by diverse and uncommon. Temperature climate group A rotaviruses outro cooler months. Detection in feces, immune electron microscope viruses in the tissue culture. This is how it looks, rotavirus. The electron microscopy. Detection viral antigen by enzyme linked immunosorbent assay. Detection by immunosorbent assay, and you can do RT-PCR, more sensitive detection. You can do RT-PCR. Typing of G method, G serotypes, P genotypes, RNA sequencing, neutralization test respectively. Serological test, ELISA. Treatment mainly supportive correct loss by water and electrolytes such as oral or parenteral fluid replacement. Rotovac is vaccine available against rotavirus. Live attenuated rotavirus provides broad protection against many types of including GP in the bracket 8 type, manufactured by Bharat Biotech India, induced under National Immunization Program in India. 3 doses, 5 drops per dose, administered on 6th month, 10th month, and 14th month, 10th week. Sorry, not 6 weeks, 10 weeks, 14 weeks, along with DPT and OPV. Overall efficacy first 2 years, lifelong about 55%. Side effects: crying, irritability, fever, and diarrhea. No vaccine-induced interception has been reported. Rotarix contains attenuated GP in bracket 8 strain, also provides cross protection against G3, G4, G9, reconstituted before use, given 2 doses, first week 6 weeks and second dose given at 4 weeks later. Measures improving hygiene, contact precautions, strict hygiene to prevent transmission of infected persons. Other agents: calciviridae, normovirus, sapovirus, icosahedral contains single strain single single strain of positive RNA. Other agents are Norvac virus, sapovirus, adenovirus, astrovirus, respiratory virus, norovirus, picovirna viruses. Thank you. Thank you very much.